Hello everyone, welcome to US Residency Training and Beyond. This is Dr. Viswanath Aluru, attending physician in physical medicine and rehabilitation at Optional Health in New Orleans. In this video, we will continue with our previous topic, patient care. As I mentioned before, good patient care comes with good principles, good habits which you practice day in and day out. So starting with your getting the morning sign out, being on time to get your morning sign out, because the on-call physician, resident physician, will be taking all the calls, for all the departments, for all the patients on the floor, including any new consults coming in the emergency room or dealing with OR situations if you're a surgery resident. So it's important for you to be on time to get that sign out first. So once you get the sign out, you need to know what happened for any of your patients that you're covering overnight, any new patients that came in under your service overnight. So it's very important to get a thorough sign out first. Once you have your sign out, the next most important for you to do is to print a new list, because your service might have new patients that are added to your list, or patients that were moved to different rooms, or patients that might have gone to emergency room or so there might be several changes since you have signed out last previous day evening. So it's always important that you should print a new list for that day in the morning for the service that you are covering. So if you're in an academic program, you might have medical students with you, rotating with you, observing you, shadowing you. So I highly recommend you involve them actively in the process from the beginning of the day, so that they will not only learn from you, but they will also help you. Say if your list has about 20 patients, that you have to gather information first and then go see all of them in your rounds, pre-rounding, before you round with your senior resident or chief resident. So you have to manage time. So time management is a very important process. That's why then you have to remember my another quality that I mentioned in the qualities video is organizing and prioritizing. So that's why if you have 20 patients on your list, you ask the medical student to grab a chair, sit with you to see and explain to them what are you looking for, so they can help you on few patients. So the first important thing after you get the sign out is to gather the information. So you have to click on each and every single patient chart on your list, and then look at the vitals, look at any labs for the morning, and then check on any things that have happened since you signed out yesterday evening. So there might be new consult recommendations coming in, or there might be some other transfers or acute care stuff that have happened that you are not aware of. And that's why it's important to pay close attention to the sign out in the morning, and also check everything by yourself. Again, remember the rule, I call it WOW protocol. So VAAV means verify, act, address, verify again. So you have to follow this protocol every single time. So you have to verify everything that you have noted during the sign out. So you check the labs, you check the vitals, and when you're checking, it's hard to keep track of everything. So that's why when you print the list, I recommend you make a note of the any important things that you need to address when you're rounding, or immediately before rounding or after rounding. So you develop your own methodology. So I used to have a mnemonic where I have N is for notes, L is for labs, or is for referrals and repletions. So if you're checking the vitals, if you see there's a change in heart rate, or there's change in the respiratory rate, or there's a change in the blood pressure fluctuations, or blood glucose trends, so you have to trend those things, or ins and outs, because in surgery there's so many drains, or the patient might be on IV fluids, IV medications. It's important to thoroughly review each and every single chart. You make a note, so you follow your own methodology and be consistent across all the patients. So in that way, you're not missing anything when you're checking on each and every single patient's chart first thing in the morning. So you also look at the meds, click on the meds tab to see are there any meds that need to be renewed, or there any meds that can be changed. If they're like IV meds, that can be changed to PO meds, or that any meds that can be weaned off or discontinued. Okay, so it's important that you check all the charts, labs, vitals, medications, any new notes that are put in, or any new referral recommendations that were made since yesterday evening. So you make a brief note next to each patient on your patient sheet that you printed out. So you have to do this for all the patients. So by the end of all your, say if you spent like 1 hour, say you got the sign out at 5 o'clock in the morning, and you spent an hour reviewing all the charts and making a brief note next to each patient on your list. Now, so at 6 o'clock, you start rounding, so you can take help from the medical student. In that way, they also learn from you, and they'll also help you actively involve them in the process. That's why it's important to explain to them what are you looking for. So if you're checking like 10 patients on your list, they can help you with another 5 patients. So in that way, it becomes easier for you to gather all the information and ask them to present to you if they found something that's unusual that needs to be taken care of. So in that way, you can complete reviewing all the charts in the morning, spend an hour depending on your patient load, and then go see your patients. It's called pre-rounding. Say if you're starting pre-rounding at 6 o'clock, you try to finish as much as possible. If the senior resident is already available, you can round with them, and then you will have like an hour time, in the morning to round, and then you have to go to the morning report. So when you're pre-rounding or rounding with your senior physician or senior resident, so basically you go through the list of things that you noted on the sheet next to each patient, and try to address those things. Explain to them what happened since yesterday that you saw them last time, and what changes made to the medications, what changes made in the plan of care, are there any discharge recommendation, any discharge plan. So it's important to communicate. Again, going back to our rules for good patient care, communication is the key. You definitely need to communicate everything that's going on with the patient or with the immediate family member who is in charge or taking care of the patient. Communication is the most important thing. But if you're seeing the patient for the first time, say a new patient got admitted last night and you are not aware of this patient, it's a new admission that was admitted by the on-call physician, so you're going to see that patient first time in the morning. So you need to review the chart, because when they admit the patient, they usually do the note, right? They do like a consult note, and then if the patient needs an admission, then what happens is they will tell you the patient needs an admission note. So you have to review all the pertinent information that's already available in the chart, and then when you go see this patient for the first time, you have to introduce yourself, tell what is your role in the department and why are you there to see the patient, and thoroughly explain to them. So establishing that initial contact or communication with the patient is the most important thing. So you're setting the standard of care, you're setting the expectations for the patient, you're also explaining everything to the patient, what needs to be done and what the patient need to expect in the next 4 days, 5 days, or 1 week that they're going to be there. So it's very important. There's a saying, first impression is the best impression. You have to give the best possible impression to the patient on your the first interview or with the patient. Okay, and then so you gather the information, as much as information you can gather from the patient or the family. Do any pertinent examination that you have to do in relation to the admission, and then so once you're done with the rounds, so you go to the morning report. So this is something that you have to do every single day. So you start the day with getting a good sign out from the things that have happened since yesterday that you signed out to the on-call person, and try to follow up on those things. So review all the charts, go through each and every single patient chart under your service, review their vitals, review their ins and outs, medications, any new notes that are put in, any new consult recommendation that came in. So all those things, and also review any new admissions that came under your service overnight. So this is what you have to do every single day. So with this, I'm going to end this video. We will continue with the patient care. It's a big topic, so there will be several videos on patient care. So we're going to discuss in detail about each and every aspect of the patient care, and I hope to see you all again in another video. Have a good day. Bye.